our objective is to allow the practice of alternative medicine. And we'll get into just what that means, but I have a strong impression that we're at a point in our country where either we have freedom or we are in a big mess.
Right.
And so I want to make sure. So let's go ahead. Number one, we're going to talk about what it is. We're going to ask, is this something new? Is this something we're trying to introduce all on our own? Okay, and then we're going to talk about, is it scientific? Is it necessary? And is it available? And if it is not available, why not? Okay. Now, ordinary revised statute, that's basically the law. Those are the laws that, well, some of the laws. We won't get into all this administrative rule and all these things. But the ordinary revised statute, or ORS, is what governs our lives. And in 677190, paragraph A, this is what it says. The board may discipline someone for unprofessional practices. But then in 1995, we got the law changed, so it said, for purposes of this subsection, the use of an alternative treatment shall not constitute unprofessional behavior. I'm trying to train my button pusher here.
Not on the job.
Okay, now, this is what it says now. A treatment that the treating physician, based on his professional experience, has an objective basis, a reasonable probability, those are my emphasis, and even though it's outside recognized scientific guidelines, is unproven and no longer used or lacks the approval of the FDA. All of those things can mean that if a doctor feels that these things are met, he can use that treatment. Okay. All you need is those three things plus one other doctor. If you have those things and one other doctor, it's legal. And according to the law, the medical board cannot discipline someone for using an alternative treatment. And this is the definition. And then it poses no greater risk. So I guess you'd have to ask yourself, does magnesium have a greater risk than lisinopril? But that's basically what we're talking about. I mean, that's the kind of thing we're talking about. Okay, well, is it new? Well, in 1777, they were trying to write a constitution. And Benjamin Rush, in fact, he was George Washington's doctor, thought we'd better be careful. And he said, we'd better put medical freedom into the Constitution. Because he knew human nature. And he knew if you didn't do that, they just might develop an undercover dictatorship. You don't think that those good doctors would do that, do you? And this really, we weren't going to get into it, but this gets back to this whole idea, is it necessary to license doctors? Who is really protected when we license doctors? You know, the law says, for the public good, we're going to license doctors, so you will be protected. Okay, Benjamin Rush and the Founding Fathers felt, you know, let people make that choice. Let people be responsible. All laws, all such laws are un-American and despotic and have no place in the republic. They thought it should, they didn't get around to it. But it's not new. This idea that people should be free to be treated the way they feel is best is not a new idea. Next slide, Dan. Okay, in 1964, they had a meeting in Helsinki, in the World Health Organization, and actually the AMA signed off on this. They said basically the same thing that the law we have in 1995 said. I love the way they said. I put that emphasis on proven. How many proven therapies are there? I don't know. Okay, it said the same thing. Where the proven methods aren't working, people must be free to use an unproven method or a new method. Next slide. Okay, now this is, I'm not sure how many of you are Far Side fans. Never mind. If you can't see it, there's some cows standing out in the field. And they're all standing up talking on their back legs, talking. And their lookout cow says, hey, there's a car coming. So they all get down their four legs. And as the car goes by, and then as soon as the car's out of sight, they're all standing up. Now, which is reality? Anyway, and the other reality we sometimes get mixed up about is the idea that the practice of medicine is scientific. How many of you feel that the practice of medicine is scientific? You people better not raise your hand. Okay, the next slide. Okay, now this is straight out of government publications. This is out of from the Office of Technological Assessment, and you can go get that publication. Like estimated that only 10 to 20% of all procedures they use on us have been shown to be effective. 10 to 20%. Don't read about this if you have a doctor's appointment. Might make it a little bit. Okay, next slide, please. Okay, now another government report. What's a quack? Well, as using this report, a quack is anyone who promotes a therapy that he's known to be false or which is unproven. That's interesting, isn't it? Okay, now the conclusion of this is orthodox medicine is unproven. Therefore, using the government's own definitions, orthodox medicine is quackery, at least 80+% of the time. Well, that's not the way here. If you sell a vitamin, you're a quack. You know, if you say you shouldn't drink Pepsi-Cola, you're a quack, even with a vitamin. But I think we need to make people live by their own rules. And this is how they define quackery. And by their own admission, most of what's done in the field of medicine today is quackery. It's very interesting. You know, there's this big debate going back and forth about vaccines. Interesting point was brought up the other day that there's never been a double-blind study on vaccinations. You ever wonder that?
Something.
They actually did a double-blind. They rarely do double-blind studies on surgical procedures, although they did do one some years ago on bypass surgery. And what they did, they actually took some people and they just cut their chest open. They didn't do anything. And those people got well just as fast as the people that actually had bypass surgery.
Uh-oh.
Thank you. Next slide, please. Okay, is alternative medicine necessary? Well, according to the definition of alternative medicine and the state of art of traditional medicine, I think people should be free to make that choice themselves. No one's saying we ought to pass a law that outlaws traditional, conventional medicine. There's a lot of good there, especially if you're in acute situations, emergencies. It's the best place in the world to be. But Benjamin Rush and the people that signed on in Helsinki, which was the American Medical Association, and also the 1995 Oregon legislature, felt that we should have a little more freedom. Next one. Okay, we're going to run through here quickly just some of the things. Now, if any of you see something up there that you feel you might be able to get from your primary doctor or traditional doctor, just raise your hand. Okay, you need a chair. Yep, there's one over here. just raise your hand. You see anything up there that you think you might be able to get therapy for from your primary doctor? Okay, next one down. Intravenous vitamins and minerals, ultraviolet blood irradiation, sublingual allergy treatment, trace mineral testing, provocative heavy metal testing, intestinal permeability, prolotherapy. No hands yet? Okay, next slide. Dark field microscopy, visual contrast testing, mercury detoxification, homeopathy, glutathione, epidermal allergy testing. Still no hands? Okay. Next one. How about electrodermal testing for inflammation or clinical thyroid evaluation? I just got to repeat. Thermography, phosphatidylcholine therapy. Still no hands, huh? Okay. Those are all things that have been around for years. These aren't new things. Most of the things have been around for, I don't know, 20, 30 years. Next one. So they aren't new. Are there organizations? Are there other doctors? There's literally thousands of doctors. But unfortunately, a lot of them are sort of in the same boat I'm in. And it's just a sort of a scratch the surface of the various organizations that are, that alternative doctors form. And they have various names. There's integrative medicine, there's holistic medicine, there's functional medicine, there's a whole lot of different names. But basically, they're doing things that are defined by the law we have, by the Helsinki Agreement. So they aren't crazy things. Okay, next slide, please. Is alternative medicine available? Well, since no one raised their hand, I guess we have to say, generally speaking, either a lot of those things that there are, I guess some of you have never even heard about. I mean, it's tragic, really. I mean, let's say, for example, you tear your rotator cuff. That's a shoulder injury. And you go to your doctor, and the doctor says, well, you need, you get physical therapy, and you might get, chiropractic, I don't know. But then, your last option that he gives you is surgery. And I don't know what it costs to have a rotator cuff repaired in the hospital, but I would guess it's $15,000 to $20,000. It's hard to get out of the hospital. Our son broke his arm, and we went to the emergency room late at night. It was a bad fracture, and they had to put him to sleep and traction it and set it. But our bill is $5,000. We were there 3 hours. So it's not cheap. But you can, prolotherapy on a rotator cuff tear can usually fix it in 1 or 2 sessions, and for a cost of less than $200. I mean, I really personally feel that the only solution to the healthcare crisis we have is alternative medicine. There are a few naturopaths that are doing it, but they do a few of those things we listed. But it's really quite frightening because the medicine likes to picture itself as progressive. We're always looking for new ways of taking better care of you. Well, right now they have a Department of Integrative Medicine up in Portland, at the medical school, and they are now in the process of integrating with chiropractors and naturopaths. Now, 30, 40 years ago, they integrated with the osteopaths, and now it's hard to find an osteopath that manipulates. Our son's in osteopathic school, and he had to take an internship away from the school to get osteopathic training. They say they get a little bit, but most of it, guess what they're teaching them now?
Drugs.
Yeah, pharmaceutical. They take pharmacy. And so it's my feeling that what's happening with the integrated program in Portland is that the naturopaths and the chiropractors are going to learn to prescribe, while the medical doctors learn very little about manipulation, hot cold therapy, castor oil, things like that. So I would venture a guess in the next 10, 15 years, chiropractors are just sort of a doctor that might crack your back occasionally. I really don't think the medical school is going to teach chiropractic manipulation for some reason. I just don't feel that's going to happen. So it's a bit frightening. Next slide, Dan, please. So scientific merit, is that an oxymoron? Kind of is. Albert Einstein was once asked to define scientific medicine, and he said, that's too difficult a question. I can't answer that. Someone from the medical board once was asked to define it, and he said, well, it's sort of like air. You know, everybody knows what it is, but you just don't know how to say it. Okay, next, please. But I like that saying, if it works, it's scientific. Just because we may not understand it. If it works, there's some scientific principle behind the fact that it worked. Okay, why isn't alternative medicine available? That's a fascinating question. Any ideas? Susie, what do you think? Why isn't it available? Don't think
I
about
wasn't
it.
even paying attention because Corey was
Repeat
talking.
the
I was
question.
worried.
Yes.
People might get healthy.
People might get healthy.
No, there's no money in it.
Okay. Yeah, it's not very profitable.
Well,
You know, frequently,
Can't patent
if you go to a doctor, it's not unusual that your doctor, the traditional, you go to the clinic, I don't care where it is, it's not unusual for the doctor you're seeing to also have maybe 30, 40 other people scheduled that same day. So, okay, but as you leave, I didn't want to give it to you before I came there, you're going to get a copy of an article. It's called, "Why Doesn't My Endocrinologist Know This?" It's basically, it's about thyroid, but it applies to, and one of the first things they say in the article is that doctors don't read medical journals. And it's well referenced. They got this information out of the major medical journals. They don't have time. After you see 30 or 40 people do the paperwork, how much time is left in the day? So doctors frequently rely on what we call guidelines. So the Professional Medical Association comes together with guidelines. There's the Endocrine Society, there's the American Academy of Clinical Endocrinology, there's the American Urological Association. There's all these societies that doctors get together and they publish guidelines. Well, if you read the fine print, the Endocrine Society came out in 2006 with guidelines for the treatment with testosterone. Well, I don't know why they did this, but in the first part of the article, they graded the evidence that was used to come up with these guidelines. And the guidelines for the treatment with testosterone, 65% of them were based on very poor quality evidence, and 35% of the guidelines were based on poor quality evidence. None of the guidelines were based on even fair or good quality evidence. So,
Jack,
yes.
could you just ask who has not received a dinner?
Who has not gotten a dinner? Well, no one's gotten dinner. They're just serving them. They're just coming in with the top plate.
Oh, good, okay.
Okay. So much for the guidelines.
Dr. Gambee?
Yes.
My primary care physician, Springfield at the time, told me very clearly that he received no training in medical school for alternative medicine.
Oh, no.
Not one course, not 1 hour credit, nothing. And he said that about 50% of his patients are doing alternative and they're getting better, they're getting healed. He just tells them to keep doing it. And about the 50% others he prescribes.
Good for him.
And yeah, that was good. But if they're not getting any training, there's no
Well, yeah,
foundation.
it's a real dilemma because pharmaceutical money is a large portion of the medical school budget. And I don't care if we're talking about medical school or osteopathic school. So they teach what the people that provide the money want them to teach.
Mm-hmm. That's
So
right.
it's a dilemma. And the other thing is doctors fear being different. The vast majority of doctors now practice in groups. And if you don't do what the other doctors in your group are doing, they either tell you to quit doing what you're doing or they kick you out.
Mm-hmm.
Those of you that have chickens understand this. If one chicken is a little different than the others, the other chickens just it to death. So the doctors are sort of like chickens. Okay. It's very time consuming. Alternative medicine is time consuming in some ways. But in the long run, it saves everybody so much time. It's not as profitable. And then we have medical boards and the FDA and insurance companies that we're really in a dilemma. It's also, I think the latest figure gave my, what's it cost to develop a new drug and get it on the market?
They say probably several $100 million.
Several $100 billion.
Or more.
15 years.
How many years?
Pardon?
How many years to get it through?
Well, yeah, it may
Well, they're
take.
pushing it through as fast as they can right now.
Yeah, several, now, you have to have a patent to make it profitable. And you can't patent many things that are good for us. And this article you're gonna get also showed that the average lag time between the time when this information became available and when you actually see it being implemented in private practice is about 17 years.
Are you talking about traditional medicine?
Yeah. And that's why you see so much, it's never going to be, you're never going to see a publication about the use of intravenous magnesium for migraine headaches, for example, or for hypertension. Because the FDA says you can't say that unless you have our approval, and you can't get our approval unless you spend $100 million. And so it's a real catch-22. And unfortunately, the officials from the pharmaceutical company go to work for the FDA, and the officials from the FDA go back to work for the pharmaceuticals. Great for business, but bad for us. Okay, Dan, one more. Okay, so the question is, which came first?
He has a hang-up.
That's why we really missed out when they didn't give credit. Thank my father-in-law. Okay.
Yeah, right.
Well, which is more profitable, wholesome food or Prozac? Okay, Dan. Okay, this is something, if you don't get anything else out of the evening, remember that chronic disease is deficiencies. They're deficiencies. That's why we wear out. Old age is basically deficiencies. And unless it's hard, because once you get to be our age, at least my age, maybe a few years, we're way behind time. We're way behind. It's hard to catch up. Next one. This is Linus Pauling. This is a quote from him. My most important recommendation is you take vitamins and minerals every day in optimal amounts. Now, Linus Pauling kind of coined the phrase orthomolecular, which basically means the right stuff at the right time in the right amount. And all three are critical. All three are critical. If anyone was missing, you've missed out. He said to supplement the vitamins you receive from your food. Okay, next. Okay, your health is too important. For all these reasons we just said, your health is too important. You've got to take responsibility. You cannot wait for your doctor to come up with this idea. You've got to take responsibility. You can learn. There's so much good information on the internet now. You can become more, you can know more about, for example, thyroid condition than your doctor.
Easy.
And you can probably learn know more about most chronic conditions than your doctor knows. To give him a little slack, he's spending his time trying to learn about diabetes and arthritis and heart disease and cancer and all these other things. I won't give your specialists quite as much slack, but anyway, you just have to focus on one or two things. But you really need to. If you don't, someone once said, if you don't take time to stay healthy, you'll be forced to take time to get sick. That is so true. Okay. Okay, now, I probably shouldn't even show this. How many of you have heard of the Federal Coordinating Council for Comparative Effectiveness Research?
Impressive.
I hope you think that might be a government agency? Well, Now, I haven't seen this, but a reputable person has said this is part of President Obama's health care plan, and which will be implemented in 2013. And what basically it is, they have a formula. They take the cost of the therapy and divide it by the number of years they expect you to benefit from that therapy and come up with a number. And if that number falls below a certain point on a scale, you are denied treatment. And that next little jewel of an organization called the National Coordinator for Health Information Technology, by 2013, apparently all medical offices that get reimbursement from the federal government have to be electronic to protect your privacy, right? What I heard was the doctor you see codes in your diagnosis. That code goes to Washington, D.C. immediately. Have you ever written a letter? Have you written a letter to one of your legislators? And let's say you're worried about the Environmental Protection Agency, and you get back a letter probably the next day or two. And you have a little suspicion that maybe a foreign letter. So if you go online and look at your legislator's website, he says, and you want to write a letter, he gives you a choice about 20 categories: taxes, foreign aid, the environment, and he's got a letter for every one of those choices you get. Well, as soon as that information goes on the computer, the program in Washington, D.C. sends back to that doctor the treatment options he has. Now, the doctor that appeared before a congressional committee said to the committee, well, I've been practicing 30 years. I think I kind of know what might work for this person. What if I don't follow one of your guidelines? And the guy says, well, you get a fine. And, oh, great, he says. So I charge $50 and you fine me $100. And the legislator apparently said with a straight face, no, that wouldn't hurt. It's $100,000 for the first offense.
Wow.
And the doctor said, what if I do it again? He says, you go to jail. So now I can't document that's true, but there's a reputable source, and it's just one of these things buried in that 2,000-page piece of legislation that very, very, very few people have read. Do we have one of those anomalies in here that read that legislation? That would really be okay. Really damn right. Okay, so we're just grateful that you're here, that you're interested, and we hopefully can get organized to a point where we retain my hope is that the doctors that have not, when they took my license away in 1994, they also kicked me out of Medicare. They said you can't do Medicare anymore. Oh, darn. And so I haven't, since I've been in practice for the last 15 years, I have not tried to get back into Medicare, because even now they sort of subtly do the same thing. The hope is that we can get so that if we aren't getting government reimbursement for medical, then we'll have more freedom. We won't have to do the electronic billing with the electronic. I just can't imagine, you read every day or you hear every day on that you need LifeLock and you need all these other things to protect your privacy. Do you think your medical information going back and forth to Washington, D.C. and your insurance companies, how private do you think that is? And unfortunately, I don't know if you see some of these internet where people say, well, I went to the doctor and one of the first things he asked me was I ever angry? Do I feel angry? Do I feel depressed? And if you answer yes to those questions, that triggers a red flag and all sorts of funny things happen to your records. And I don't know if you can get them raised, but I kind of doubt it. So anyway, thank you for coming here. We've got some things that I'd like to be able to say to people, this is what you can do, not just talk a lot. But thank you very much.
Things that Jack said. He said that doctors are very busy learning about diabetes and all these other things. Where do they really learn? Where do most doctors learn what drug to take? Do they really study so much about diabetes, or do they learn what drug to prescribe? And where do they learn? Where do they get such a quick, simple course?
When we come to sell a drug.
Pharmaceutical salesman, exactly. That's it. Okay, I knew this audience was smart, smarter than Jack. We're hoping that when Jack said that somebody will say the FDA doesn't approve that, we're hoping that because you looked at the law in the PowerPoint, did that rub you a little wrong? It should rub you wrong. You should be able to say to yourself, but it doesn't have to be approved by the FDA. That's what the Oregon law says. So remember that. You know, when he was talking about chickens, we have a chicken that all of our other hens and roosters do not like, and her name is Benedict. But we changed it to Benedicta because we found out she was a hen. But the poor thing, she just never fit in, and they are very mean to her. Her back was all cut up today. But she drives us crazy. Every morning Jack gets the hose and comes up on the back porch and hoses it off because Benedict spends the night eating cat food and everything for the other animals, and then she messes up the porch. So it's not helpful that they're not kind to her. Now, where else is medicine the biggest business in the country? Do you realize how insane this is? It doesn't make any sense. Yes?
The food industry.
The food industry, right. But this is pathetic, and the government is starting to get the idea, they're getting it, that they don't want to spend money on you either. But it shouldn't be costly. And there are a lot of ways that it wouldn't have to be costly. It would change the structure of medicine very much. When Jack quoted a doctor, he said a doctor somewhere said that, well, scientific means kind of like air. You know what it means, but you can't see it or feel it. That wasn't just a doctor somewhere. That was a witness for the Oregon Medical Board at his first contested case hearing. This was a doctor, a big doctor on the medical board, and that's what he said. And that's what they get away with. They say Jack likes to be in uncharted waters. Where in the law does it say you can't go in an uncharted water? Besides, alternative medicine is as old as the hills. It's not at all uncharted. A couple other things. He talked about the osteopaths, how they've integrated with the medical doctors and aren't really different, most of them. One example of this is that when his license was taken the first time in 1994, the chairman of the board was an osteopathic physician. The vice chairman of the board was an osteopathic physician. Jack was very much for craniosacral and things, osteopathic thing that the osteopathic doctors didn't want anybody doing anymore. Not enough money in it. Jack mentioned that some of these things are 20 to 30 years old, some of these alternative things. Well, he started doing them 40 years ago, actually 60, so I think you're a little short on your thing there. For a minute, Jack, I thought you were Saul Alinsky. Did anybody think the same thing? Did you hear something he said that's very Saul Alinsky? Who said that? Raise your hand. Johnny. That's it. Saul Alinsky was a great, what's the word for terror?
Communist.
Well, and someone who tears things down, right, he was, I know because I brought the president of the Communist Party to Oregon State a few decades ago, and I also helped get the Students for Democratic Society going there, because I was naive, like a lot of doctors and a lot of people are today. But after 3 or 4 months, I got my head on and I started thinking, they want to make all the corporations and things live by their own rules. It sounds good, but they don't live by any rules at all. And so I was able to remove myself eventually from that. I'm almost done here. When we talk about whether medicine, alternative medicine is proven or traditional medicine is proven, and almost none of it is traditionally, you're the provers. You've tried it. You're the ones that try all these different things, alternative things, traditional things. You're the ones that know if it worked. You are the provers, not some half-baked, now not even credible research that's done. My dad was a research scientist, and it broke his heart to see how research was changing and it wasn't actual anymore. It was all biased and so forth. So another way you know that things aren't proven is who can stand and tell us all what the half-life of medical literature means? Go ahead. You raise your hand. You're good. Go.
I think it means that if it, you know, I think
Speak
about
up. Kind of turn that
so
way.
many years, I don't know how many years, it'll be like not considered true anymore, or it's not true to begin with. And there was a guy who wrote a book years ago about that. His name was Kahn. He said there's paradigm shifts all the time.
Yeah,
in
all the
science.
time. The doctors know it's not proven. If it were proven, these drugs wouldn't be withdrawn. The half-life of medical literature wouldn't be so short, and so it's all obvious, really. Now,
Looks like
I think Thomas Jefferson, I think Benjamin Rush was Thomas Jefferson's doctor.
George Washington's.
Was it George Washington? You get the prize. You get the prize. We had prizes to bring for you, and we didn't bring them. But if you answer a question really well, like this fellow did, we'll tell you you go by the office and pick up a prize. Let's see. All right, we're going to move to the presentations. And we're going to listen to Dr. David Tanton. I want to say just a couple things. Most of you, some of you heard him speak. Raise your hand if you heard Dr. Tanton talk last time. Okay. We are going to get him to speak louder, right? And you're going to be able to hear. Now, if you don't hear, all you have to do is raise your hand. You don't get a prize, but we will know that that means for Dr. Dave to speak louder. He has a very soft spirit, a very soft voice. He's not, I say he's a man with a satisfied ego. He's a genius. He knows so much, and he wants to share, and he wants to help, and that's his goal. It isn't to be famous or to be funny, or he's just such a good man, and so we want to hear you, Dave. I'd like everybody in the room who's ever been in the business of lumber, if you've been a lumberman, would you please stand up? Aha, 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 guy. No, stay up, stay up. Look at this. Dave, stand up. I want the rest of you to know you're getting outnumbered by the lumbermen. Okay? You go ahead and sit down. My only complaint about the Valley River Center is they took down the big saw.
Oh, they just moved it.
They just moved it?
Yeah, it's back there now.
It's back there now? Yay! That is the best news I've heard in the last minute. That's good, because I thought, no, we cannot be ashamed of our history of lumber. All right, now, and there are extremes in everything, and I remember I was down in the utility room in the basement doing the laundry in our home in Springfield. That had to have been so many years ago. And I remember I was leafing through, waiting for the dryer to finish, leafing through an environmental magazine. Remember, I brought Saul Linsky. I mean, he was my mentor. And I had my, Jack and I are environmentalists. We taught our children to compost, to reuse and reuse and reuse, and we're not phony about it. But I was leafing through my magazine and I read this article and I was startled. It said, and if the spotted owl doesn't work, but they were trying to change behavior and thoughts in America. If the spotted owl doesn't work, we can always go to the salmon.
That's what they've done.
Interesting. So we have to do our own work, don't we? We have to keep learning. And I'm going to give you one more example before Dave comes up. There are so many alternatives that we can use. When the board was trying to get Jack's license the first time in 1991, 92, 93, and 94, they made a board complaint, and then 4 years later they finally revoked him. But do you know who represents the medical boards? Do you know who prosecutes a doctor like Jack? It's the Attorney General's office, you know, the Department of Justice. They provide attorneys for all these state agencies. And we had a friend in Junction City who's now moved, but he was a lawyer and he was an assistant attorney general in Salem for the Department of Justice. But he left, and he said the reason I left was whenever a citizen came to the building or a letter from a citizen came in criticizing a school board, any of the 65 boards, agencies, I should say, the state agencies, the memos would circulate around the entire DOJ office. Defend the agency. Defend the agency. Well, those same, the Department of Justice furnishes the lawyers who prosecute the doctor. And the medical board said to Jack, we want you, if you want to just be on probation and keep your license, we want you to sign away your right to a hearing. Now, Jack was, honestly, you would not believe how reasonable he had been. The board attorney came one day and he had a list from the board. He said, I've got a list of 10 things. You're going to have to change your ways, Dr. Gambee. And so they went through the list. And in the interest of time, I'm not going to be literal here, but all right, you're doing A, and you've got to stop. And Jack said, oh, I've never done that, but I never will. And then they say, you did B, you're doing B. Jack said, yeah, I did do that 15 years ago, but I haven't done it since, and I won't start again. And the whole list went down like that. Jack was absolutely agreeable to everything, because there's always something else you can do, and they had all their information wrong anyway. And this attorney had been real nice and smooth at first. He said, you know, I have an alternative. I see a naturopath myself, and I think there's a lot in this. And he was, oh, we're just all on the same level here. But after Jack agreed to doing all these things, Paul Sundemeyer picked up his papers and he squeezes them and he says, you're gonna have to give me something more to take back to the board. I can't take back to the board that you agree with all those things. And he said, you need to sign away your hearing. And Jack said, that's the one thing I can't do. Now, how unreasonable is that? He agreed to everything else, and he wouldn't sign away his hearing. So they immediately pushed him into a contested hearing on a date that his attorney couldn't be there and wanted to reschedule. When do lawyers not help each other? When one of them is a board attorney. So he went to his contested case hearing without an attorney. And he did a great job, and they took his license because they can. So, keep learning. There's just 100 things out there. That we can be young, we can feel good, and it can cost a lot less money. All right, David.
Okay, don't be bashful if I don't talk loud enough.
What?
I don't enjoy it. I might add that about 50 years ago I was teaching programming, computer programming, and I had a tendency after a while I gradually talk a little quieter, so they kind of have to remind me it's just something I don't think about. You know, I'm thinking about what I'm saying and not how loud I'm saying it, but I mean it just as much whether it's loud or not. I just wanted to mention one thing to begin with. The article that I just wrote that was in the last issue, Alternatives, Dangerous Drugs, Why Has Healing Become a Crime and Disease Unpreventable? There was one little error, but it's a big issue. It was just a zero. On page 16, it said, I have considerable effort to assimilate comprehensive information on 200 of the most prescribed medications. It should be 250, so that's a lot of medications, and we spent a lot of years putting that together too, frankly. We started with 200 and we've added 50 more, and it took a lot of time. I think about 35 sources that we finally assembled it all, but it's going to be well worth it down the line, because I guarantee you, if anybody really gets this information, they're on medications, by far the majority is going to want to get off of them. Even the doctors prescribe them don't understand them, and you can't hardly blame them because that's not their specialty. That's pharmacists. In my opinion, I proposed to Dr. Kitzhoff, our governor, that the pharmacist should do the prescribing to begin with, and I still think that's true. What they did is they had some of the doctors take a test on just the drugs they're prescribing. The majority refused. Of those that agreed to, 70% failed it. And over and over I find when I'm looking at medications people are taking, they're contraindicated, dangerous combinations, and they also deplete a whole bunch of vitamins and minerals. And the majority of the medications people are placed on are for side effects of the others. And if I know the chronology or the sequence they're being prescribed, I can show them over and over again. Here's the first one, there's side effects, there's another for that. And that's why they get them on maybe a dozen or more medications. We looked at one lady that's 85 years old, was on 13 medications. She'd been on Prozac for years when her husband was passed away, which they're not supposed to prescribe for at the time, but they did it anyway. And they just left her on it. It's easier to leave them on it. You know, for one thing, if you don't know how to get them off, it could be dangerous. But leaving them on is dangerous too. So anyway, what happened is we looked at Prozac. Okay, and there was 6 different medications prescribed with Prozac that you're not supposed to prescribe with Prozac, and that's just one of the drugs that we were comparing on. And then what we do also, now what I'm trying to do is find a programmer. Eventually, I designed programs and wrote programs for the soft mainframes for quite a lot of years actually, but not the PCs. But we've got the information, and if we can automate it, it would be really easy to provide this information for anybody that wanted it, because we've spent a lot of time putting it together. And that's probably the best thing you can do to convince people what their doctors don't know and what they need to do and why they should get off of them. And the biggest problem is, outside of, I call it typical domino effect, most of them are prescribed for side effects of the others. they deplete a bunch of vitamins and minerals. Prozac, for instance, it was actually 16 different vitamins and minerals depleted by Prozac. And they got FDA approved putting fluoride in Prozac. First one when they come out with Prozac, they're the first drug that did it. And fluoride has a lot of complications associated with it. It actually, I thought, why did they do that? I got to look at it. They did it because it's a cheap way to get the drug through the liver. It basically shuts down the liver and it drags the drug right on through. It doesn't take near as much of the drug to do it, so it's a cheap way to produce a drug, basically.
Okay, let's do double check. Did everybody hear that?
Yeah,
Don't be
yeah,
shy.
yeah. So anyway, it's a
Because
cheap
this
way
is
to
good
deliver the drug.
information.
And other companies have followed suit since. But it's got 3 molecules of fluoride for every molecule of Prozac. Fluoride shuts down the receptors, the metabolism, and it'll cause iodine deficiency disorder, which lowers the IQ. And they find in China and India, where they have high levels of fluoride from volcanic action, they don't add it to the water like we do. The kids have a lower IQ, and the higher the fluoride, the lower their IQ. And a lot of our kids are being put on Prozac now because of that book that Jack is selling now that I wrote. I talk about 16 different medications that they're prescribing now, mind-altering drugs. And Prozac is one of them. Well, the other problem associated with Prozac, it causes a bipolar disorder. That's one of the typical side effects. And now they give them Zyprexa for that. Well, that's an antipsychotic also by Eli Lilly. And guess what? It causes rapid weight gain and diabetes. And they wonder why all these kids are gaining weight, becoming diabetic. It's those medications. They're blaming everything else. That's the thing that in actually 8 years' time, 500% increase in kids being put on those drugs. And you wonder why they're having so many health issues. Yes?
How do you spell that other word that they take them off Prozac and put them on what? Because of bipolar?
They leave them on Prozac, but they add Zyprexa and
How do you spell
antipsychotic.
that?
How
How do you spell it?
CYPREXA. PREXA. It's an antipsychotic.
And that's in your book, right?
Yeah, it's in that book that Jack, the antidepressant book. And then after that, then they get diabetes, okay? And they spent $1.4 billion several years ago settling litigation for adults that got rapid weight gain and diabetes. And Regard, they talked about one lady that gained 65 pounds and become diabetic in 1 year on Prozac. On Zyprexa, excuse me. So then, what happens? They put them on diabetes medications. Now our kids a lot of them are diabetic and on diabetes medications. Well, I wrote a book on resolving type 2 diabetes and removing fat to both metabolic conditions, but the fact is, the medications they give them for diabetes causes diabetes. And I show exactly how it does it. And as long as you stay on this drugs, you're going to be a diabetic. In 30 days, you can reverse type 2 diabetes and sometimes type 1. And get off the medications, and if you never get off the medications, you're always going to be a diabetic because they're depleting everything you need to produce quality insulin. When your insulin quality goes down, your insulin resistance goes up, so they're causing the condition, really. And they're promoting everything you shouldn't do, but they want to stay in business. And so that if you follow the diabetes medications recommendations, you're going to be a diabetic forever, really, and you don't have to be. And it's really easy to resolve. It's surprisingly easy to resolve. I could easily conduct a study and show that in 30 days I could take a whole group of diabetics, type 2, and they'd no longer be a diabetic. Now what they're promoting is to do that stomach bypass surgery. They say, oh, okay, guess what? You know, their diabetes went away. All they had to do is staple their stomach and remove most of it. And they're just looking for another way to make money. But American Diabetes Association recommends taking cholesterol medications. Well, guess what? That's where a lot of their funding comes from. But just recently even announced the fact that it causes diabetes, contributes to diabetes and dementia and Alzheimer's. And I always talk about how it does that too. And yet a lot of people are on the drug. It's the worst fraud there ever was. Nobody should ever be on cholesterol medications. And they'll sap your energy, and they can cause congestive heart failure. Your heart gets weak, your kidneys could shut down, your muscles get weak, and there's so many conditions associated with the statin drugs. It's total fraud, and nobody should ever take it. And I would tell anybody immediately get off your cholesterol medication and without any concern, because it's the worst thing you could do. There's no benefit whatsoever. Our cholesterol, the low-density cholesterol is just as important as the high-density cholesterol. They both have functions. And basically, if you didn't have enough of either one, you could be in trouble. And one of the things is that your brain has more cholesterol than any other area, and when you don't have enough, you're contributing to Alzheimer's, really, and because all the neurons are insulated with cholesterol. So it's one of those things that the closer you look at medications, the worse it gets. And frankly, what I'm hoping that somehow we can start educating people. We need to get organized somehow to figure out how to do this. And we got two options, or one or two at least. If we really want to stop these guys from pulling license and threatening the doctors, we got to give them the free agent. They're taking away your free agency, what they're doing, and then the insurance companies are doing the same thing. You know, if you want drugs and surgery, fine, we'll cover you. If you don't, while you're on your own, we'll put about all the poor and they can't afford to pay for their own health care, and they're just out in the dark, really. So this is something that has to quit. And I thought I wrote something, and I told Jack about it, and I was going to have everybody sign up that wanted me to email it to him, but he said he could probably put it out there and get it to you guys or something. And as I talk about what they're doing to our doctors. You know, a lot of them are victims. You know, they're really all victims, really, that are MDs that are practicing, and because they can't really practice prevention. You know, prevention is illegal, and cure disease is illegal, because drugs can't prevent or cure disease, either one. As long as they are restricted to that, our health care is going to go up like it has for years, and all the rates of every one of the diseases keeps escalating. And I wrote a book on Alzheimer's and taking the mystery out of Alzheimer's, and I can show you where there's ways you can reverse it. And I think I talked about that a little bit last time. And some people were diagnosed 4 to 6 years with it, and in a short time they're back to normal. And in it they're saying there's no cure, and they're looking for another drug. It'll never be found in a drug, I guarantee it. There's a Dr. Fowle that actually was over the Alzheimer's Association about 77 different locations through the U.S. and Canada, and he said that they actually tested over 100 drugs so far without any success, and yet they keep trying. And now they're petitioning the federal government to, and I think they're going to, start donating money, financing research on drugs for Alzheimer's. One more step, and yet I tried to work with them here locally, and the guy that is supposed to take over this area was a really nice guy, and he had a master's in physiology at the University of Oregon. He had my book, The Drug-Free Approach to Healthcare, and we discussed over the phone. He wanted to get together and see what we could do. He said, I need to get things organized here. He was doing a reorganization. And so next time I talked to him, he said, I'm sorry, I can't work with you. I'm leaving the organization because they're really not looking for a cure. They're looking for money. And the guy that came out from Chicago kept saying, we got to do more walkathons. We got to do something to start raising money. And he used to be with the Oregon Heart Association, and that's what he did with them, raise money. So now you're seeing advertising doing walkathons for Alzheimer's. Now the government's going to start helping funds trying to find a drug for it. And so this is the way it is with all the organizations. The American Cancer Society, they're a huge organization, very powerful. The CEOs make a huge profit, and they're not looking for an answer. And I wrote a book called Taking the Mystery Out of Cancer, and I could show where in most cases you can reverse the disease and convert the cells back to normal again, but they don't want to hear that. And you know, they're still not looking for a solution. And you know, the thing is, the only thing that is okay for a doctor to do is radiation and chemo, and that's perfectly okay. And either one individually will cause cancer, and yet they're using it for patients. And the way they manipulate figures that make it look like the rate is a lot better than it is. They try and catch it as early as they can. If you live 5 years, you're cured. Even if you die the next day with cancer, then you're cured. That's the criteria they establish so that they can make sure that it looks good. But you would have a better success of curing cancer if you did nothing. And that's a statement it's kind of hard to make, but when you consider it's 100,000, 300,000 sometimes on cancer therapies that people end up dying a lot of the time from it anyway, plus they suffer all that time. When they first did it, some doctor discovered, well, you could remove veins out of your legs and put it in your heart, and it seemed to work, and they all jumped on it and said, well, we can make a lot of money, and they're some of the highest paid. But the thing is, there's ways you can restore that heart, and you can build new blood vessels, and you don't have to have the surgery. And besides, those veins have a purpose, and now you're removing them, and now part of your circulation is gone. And it only lasts 7 to 10 years, and you have to have it over again, because those veins aren't as strong as the arteries they're replacing. Did you
I want to ask them, who would like to guess how old Dr. David is?
86.
Okay, that's 86. Any other guesses?
77.
77? 79?
Pretty close. I'll be 79 in about 5 minutes, so. So he's got
Now, there's all kind of age. Now, how do you think his brain is doing relatively to most 79-year-olds? He's still writing books. He's ready to do tremendous research if he can get the backing. I hate to cut him off, but I want you to understand that he could go on for 15 years nonstop. He knows so much. He has a generous way about him. If you have a group of friends that want to get together in a room at Trader Joe's or one of the places, you would go talk to him, wouldn't you?
Sure. It's
He'll share
Market of
everything
Choice
he's
has a
written.
room that you can schedule, and I talk to them, so we can do that too.
So don't leave without his phone number.
Do you have a website so we can find what your list of books are?
Yeah. It's just Dr. Tanton, drtanton.com, T-A-N-T-O-N.
And isn't it in your book here too?
Yeah.
Let me just give a plug. This book is really fascinating. If you go to chapter 13 and read that chapter about hypothyroidism, you'll just that chapter alone will give you more information than your doctor has. It's a great chapter for understanding what you can do about a thyroid condition. You want to know about fluoride? In Plymouth, maybe?
Book title, Jack?
You should have.
Book title?
Yeah, we've got them out here in the desk. You should have been up
He's
talking
giving
in
this
Plymouth
book
when
to us to sell for
they just
$10.
fluoridated this. Anyway, it's
I
a
talk about fluoride a lot and the dangers of fluoride, by the
and
way.
he's got his website here. It's just and this is the sort of thing you can do on your own. You don't have to get permission yet to read his book. One of these days, but it's a great book. You can almost, any page, you can find interesting things. And you don't buy two different books. It's going to take you a few months to get through this one. But it's a great book. It's a wonderful book. So I really encourage you to read that.
Now, you're going to be able to ask him more questions on our panel. So, David, I'm going to have you guys all sit down and... He sells this, he has sold this book for $24 or $28 or something, which that is really a good price for anything medical like this. But he has given us thousands of copies to sell for our fundraising, and he allows us to sell it way below his cost for $10 to you. And anybody who wants to. So we have some people that'll pick up 10 books, come in the office, because it's a great gift. So,
I think, I know this is the sort of thing, you can't go to someone and say, oh, I know you're on this medication here to read this book. But you just might send it to a book like this to someone that's on medication and just say, this might be of interest, and then drop it. Don't even follow up. Don't ask them if they've read or anything. Just give them the opportunity. That's all we can do. It's almost like a religion. You can't go to someone and say, oh, you need my religion. You just give them the opportunity, then it's their responsibility. But it's a great thing to
of possible interest. pretty simple and what a gift. All right, now I want to introduce Chris Folk. Am I saying that right?
Yeah.
Chris Folk is the son of a Dr. Fulton Corvallis that everybody that lived in Corvallis used to know who he was. His son has evolved to a higher level. He is a nutritionist. And he does biobehavioral health.
Yeah.
And you'll get to know more about him. Also, every time we have to go up, to the medical board for their investigations and fun hearings and things, Chris is always there when we need people to be there and rallying signs and things. He's up there. He has time, more time than the doctors, apparently, because he comes up to help out. So, Chris Folk and Jack and Dave, we're going to leave it open to your questions. So you can, do you want to be called Chris or Mr. Folk?
Chris.
Chris.
Great, yeah.
And Dave and Jack, why don't you just stand up when you have a question, say who you're talking to, and let's all listen up.
We'll use this microphone.
Oh yeah, here's a mic. Where's it come from?
Right there. On this side.
Okay, we've got a very long mic, except that it's caught. So Jack, how do we do this?
Isn't that for them at the table?
Oh yes, this is,
Use your outside
one of
voice.
these is for you at the table.
Is it wireless?
No, we don't have one.
Or this is to walk around?
Okay,
Okay,
we
I'll-
just gotta
I'll
We'll
get
just
this.
talk loud.
Yeah, I'll walk it around. If you have a question, raise your hand. Last time, we waited till the very end, and then you didn't have time for all the questions.
And then everybody
People
knows.
were nervous.
Okay, I don't know who this is for. The question relates to, I've been reading about GAPS and specific carbohydrate diet and the fermented vegetables and all of that, and I haven't looked into that at all before, and I wanted to get your opinions on that.
Well, I could just, share a few thoughts. My doctor recommended.
Microphone.
No, this,
I could talk loud. Can you hear me?
Not loud enough.
Okay.
Use your outside voice.
Okay. Well, I saw Dr. Gambee for several years, and then I found that there was an integrated medical doctor in Corvallis who's very, very good too, and so I've been using her, and she recommended the specific carbohydrate diet. So I'm just learning about it, but that falls right along with a lot of people who are learning about the paleo or primitive diet and having a lot of success. There's a doctor or DO named James Carlson who wrote a book. You might have seen it. He's really humorous, but he gave a title to his book that's going to repel almost everybody. It's Genocide: How Your Doctor's Dietary Ignorance Will Kill You. and he talks about his own case where he was grossly overweight, smoked, and terrible health and everything. And I don't remember what happened to him. You hear those stories all the time. Doctors, their wife is on the edge of death, and some neighbor comes over, why don't you try this vitamin, And then a month later, that's Ray Strand who wrote the book about, doctors and nutritional medicine. And he said his wife is bounding up the stairs within 1 month. And my dad, sort of a maverick, he didn't follow the crowd. We have a saying, the Ted Folk way. It's like when the group went that way, he went the other way. And so he concentrated on diet and exercise in his practice. But they had basically 1 hour of nutrition in 1940. It's up to 19.6. Can you believe that? It's astounding. But somebody told me that they're actually giving a full term of functional medicine to some doctors in some school. But anyway, about your question, the GAPS, gut and psychology syndrome. This is a British doctor, Natasha Kemmel McBride, who is very, very good. She's gone into the details of gut function and how the sickest kids in Britain, in terms of behavioral disorders, all had intestinal and digestive upsets from birth. And so that just follows, the correlation that people are making now between the gut and what we eat and the situation in the gut, the immune system. There are more neurons in our gut, and that astounds people. Our gut, sometimes called a second brain. And to respect that, because I come from the mental health end of things, and people have effectively, separated the brain from the body. It's kind of like a black box, and they give you a behavioral sort of diagnosis based on a few characteristics or what you say is going on. It's not medical, and so people are learning this stuff. It's just amazing. We are making waves. You better believe this. An example, I gave a talk in South Beach, which is a community just south of Newport, at their clinic there in 2010. Half the people in the clinic were outside, guys, mostly smoking. Now I did the same thing again this year. They were basically all inside and mostly participating. Actually, there were some new people, which makes me wonder if those people are still around. But anyway, that's a long-winded answer. But people are learning this themselves because people like Dr. Gambee are inspiring them to take charge and start to research this stuff. And almost everybody now listens when I talk. When you bring up this subject, they listen because they know it. They can't dismiss it. It used to be health is kind of funky or weird. No longer, and I think the people are going to make the waves and the change. I'm sorry.
Now here's our problem tonight is these guys all know too much. So what I want to happen is this. You ask about fermented, what are you doing?
I'm just going to get the mic back.
Oh, okay. No, I don't need it that one. You asked about fermented food. If you can, ask somebody specifically. But if you can't, then each one of you who has something to say just something as brief as you can.
Yes.
I would like to introduce our daughter, Jamila. Jamila, just stand for a second. There's a reason for this. She's 15, that's why her face looks like that. And her other daughter's 8, she's sitting over there too. But Jamila and Allie, if they would, they could tell you what their dad ferments. Why don't you tell me?
Fermented food is a superfood. Everybody should develop the ability, and it's simple. Send a SASE to the office. We'll send you an easy recipe. Fermented food is one of the foundations to this GAP diet, and it's amazing stuff. And I think we're going to hear more and more about that diet because it's making inroads where none have been made before. But learn to ferment cabbage. Just do it. Google sauerkraut.
The doctor that came up with this and wrote a book on gut and psychology syndrome, is that what you're referring to? She's going to do a training very soon, I think, if you want to find out about the Nutritional Therapy Association. It costs about $1,000 or so, but it's, they have one for schizophrenia too.
And she's coming out with another book too, Gut and Physiology Program, because it's not only your brain but your body, as she's getting at. And I'm writing a book right now on developing fetus all the way through a child's life, and are showing what you need to do before you get pregnant if possible, both of mother and father, because that affects the genetic inheritance that their children actually, the DNA is what they find through genomics. It can be modified, and they find that the health of the sperm and the egg are really important, and you can change that before the child's born. But all the way through the mother, what she's eating, not medications that they constant foods, and this GAPS one is a big one because the child actually picks up the bacteria from the mother when it's going through the birth canal. So, and Natasha Campbell McBride's got 3 different degrees, and she's super sharp, and she's really done a lot of research on that. And good share of the behavioral problems kids are having related to intestine. And one of them is behavior. A lot of the behavior disorders, and autism is a big one. And they found before most autistic kids have Crohn's, and it's a problem with the MMR vaccine. In that case, they found because they found from the measles vaccines in there, and they've tried to discredit that, but that's just another thing that they discovered. So your intestine plays an important role in your overall health. And like you said, it's a big part of your immune system, and it's got just about as many neurons as your brain does. So And they say that when in the development stage, it's almost the same tissue as the brain is, so that's really critical.
Now, Dr. Tanton's personal information, some numbers and addresses and things are inside this book cover too. Chris, I want you to spell your last name.
Okay. My last name is Folk. F, excuse me, F is in Fox, O-U-L-K-E. Using my voice.
F-O-U-L-K-E, and he practices in Corvallis, and what is the name of your?
I call my business, fledgling business, Nutrition for Biobehavioral Health, but I mean, I'm working with the whole body, basically.
Yeah. Okay, next question?
Okay, some at the back table.
I've got a question I may not need the mic for. There was a question brought up by the speaker here about the age of the panelists. How many are familiar with Will and Ariel Durante? They were a husband and wife team that wrote about the history of human civilization, and they would live well into their 90s. My question is, what effect on aging does a strong purpose and motivation have, as well as, a strong nutritional base, but when you've actually got within yourself a strong motivation, because here's these two people wrote these incredible books, and when they died within 3 months together, but they had this great purpose to do this project. What effect does that great purpose have on aging?
I'd say tremendous, and longevity has been one of my main interests, and that's why the Longevity Research Center. But I found that when I get into longevity, I look at every single disease, because if one disease can do you in, just a heart attack or whatever, suddenly you can die from it. So I'm focusing on a bunch of different diseases, and I'm looking at each one. And of course, Alzheimer's, if you want to have a productive life, you got to keep your brain active as well. And like 50 years ago, I was majoring in psychology at the University of Oregon, and I could truthfully say my brain is much more efficient now than it was then. So you have to realize there's a lot of potential, and your brain is just like the rest of your body, but everything that gets to your brain has to go through the rest of your body. So you're looking at all the organs, and when you're looking at disease, you can't isolate one disease at a time like some specialists tend to, because they all interact. And if you got one weak link, it could do you in. So that's really critical.
I should say that the last 5 years that I've been studying nutrition, as intensely as I can, and doing according to my own self-assessment, doing a lot better in a lot of ways, a lot more energy, and I kind of came awake because I was on psych meds for 35 years, and just kind of opened up, a lot of potential creativity. I can type a lot faster about 2 seconds fast. And I would talk to people, almost obsessively about nutrition. Dr. Gambee got on me for a little bit for talking too long. But then, I'm always attributing this to nutrition, but I'm one of the most active people around. I walk, a mile or 2 every day. Used to be a marathon runner. But I think I've stayed up all night, at least 9 nights in the last 4 years, writing columns or letters to talk about this issue and other, allied things. And the explanation of nutrition just seemed to be inadequate. And then I realized that having a mission and being passionate about it and trying to do something good, it brings energy from sources that I don't even understand. And it is absolutely phenomenal. I should just say one more thing. Often now, when I'm looking for something in the book, you may have had this happen, I open it up and it's right there on that page. And it happens time and time and time again.
I think what they've said is very important. It's a combination. It's a purpose and good nutrition, but it's also avoiding things like statin drugs. You've got to be smarter than your doctor and realize that this whole cholesterol issue is a hoax. It's a myth. It's a moneymaker. It's one of the most profitable businesses out there. And so it's the combination. I don't think you can isolate purpose or nutrition. It's doing them both. But staying off the drugs are going to make you worse. Yeah. China's
That's for you, Dr. Jack. I was wondering, since our last gathering, is there any new developments with the medical board? What's going on with your case?
No, we're still waiting for the Court of Appeals to give us a hearing.
Yeah.
Is there a date yet?
We're waiting for
No
the
date.
board's response.
No date.
What are some alternatives? What are some, can you hear me okay?
Yeah, you're
Oh,
loud.
good. What are some alternatives to the health conscious American from Obamacare? How can they be healthy and stay alive without it?
Without Obamacare, how can you be
Without
healthy and
Obamacare.
Well, you read a book, you learn, you get on the internet, there's just so many things you can do. I mean, you can do a whole lot better on your own without the help of your doctor if you're willing to. But you've got to, see, if you pick heart disease and cancer, that's going to kill about 75% of us. And you add diabetes, makes them both worse. But just learn about how to prevent those two conditions. Then keep your vitamin D level up, a few other things.
So why are doctors, practitioners, including dentists, petrified about discussing Obamacare? They don't even want to talk about it.
It's going to destroy them.
Yeah.
I've heard figures 48 or so % of the doctors are going to quit.
Yep, I have too.
And 32 million more Americans are going to be on Obamacare. So there's going to be rationing. And who speaks German? Well, the Germans, just the same sort of thing happened in Germany in the 30s.
Yeah, Hitler.
There's Leben, something, anyway, there's a word the Germans coined that means life not worth life. And when you got above a certain number on that, or on that scale, your life was not worth the resources of the state.
That's right.
So you're going to be in big trouble.
The word you're thinking of is Lebensmüde.
Translate that.
Tired of life.
Yeah.
Lebensmüde?
Lebensmüde.
Oh, that's,
Like
I have
Peter
that a
saying.
lot.
Peter saying.
Thank you.
Next question. Can I give you a short answer? Invert the food pyramid. Eat a lot of natural fat and protein, and put the carbohydrates up higher instead of on the large amount of calories at the base. I think that's the major thing that's killing off Americans is the high amount of sugar consumption. It's between 18 and 33% of our calories, and especially kids. And then just all these carbohydrates, which raise blood sugar, release insulin, and then you have way too much blood sugar, it creates fat, and and you're off to the races with everything else. I mean, dietary changes can make a big difference, but people have to know the truth about what is food, what's real food. To a primitive, something running around in the woods, or something they can pick or catch or whatever. And our diets changed dramatically even in the last 100 years. The type of fat, has gone from natural animal fat, milk, eggs, butter, lard, tallow, etc., to the top 7 fats are all vegetable oils, which are high in omega-6, and low in omega-3. I mean, that just right there. You can make so many changes by just changing your diet and understanding what's food.
I might just add that one of the things I wrote in my book on diabetes is years ago they decided fats make you fat. Okay. So what do? Well, it's going to taste terrible if they remove the fats and don't replace them with something, so they put more sugar in. Well, the problem is then they come up with worse sugars. High fructose corn syrup actually causes you to gain weight way faster than sugar does, because it turns into triglycerides really fast and stores as fat, and it turns off the enzyme that makes you feel satiated, leptin, and it turns on ghrelin and makes you hungry. So you eat more of it, and then they come along with the non-calorie sweeteners, which are even worse. The thing is, they found that when people eat aspartame or NutraSweet, they gain weight faster than they ever did. And it's got methyl alcohol, wood alcohol, that converts to formaldehyde in the body into formic acid, which is bee venom. And also it's got 2 highly stimulated amino acids, phenylalanine and aspartame, that actually overstimulate the brain and can kill neurons. And then you got MSG and a cytotoxin, another one, which is so when you look at these foods and what they're putting in them, I'm just, on my book I'm writing right now, I said, you forget the fast foods or anything processed food, because if you don't read labels, you'll spend a lot of your time reading labels. Fine print, a lot of words you don't understand. If you don't, there's good reason. And they change names, like MSG, now they got different names. Textured soy protein, or they're natural, flavor enhancer or whatever. But anyway, they're all deceptive and artificial sweeteners and artificial colors, and very few are real foods anymore. And that's the problem. So if you stay on those, you're always going to be unhealthy. And then you're taking drugs that are depleting a bunch of critical vitamins and minerals, and a lot of them, actually, like I say, Prozac 16. And when you combine the different drugs and all that depletion and very little nutrition in the food, you've got a dangerous combination. That's what we're dealing with.
Now, you all remember those names he just quoted to?
Oh, yeah.
That's why you need the book, because that stuff's in the book.
So are there nutritional things that can be done to help treat autoimmune disorders?
Yes, there's lots. Well, I mean, there's just what he said. That'll do a great deal. And then the fermented foods, get rid of all this inflammation we all carry around in our guts. There's lots of good guys.
You might also talk about low-dose naltrexone. For some people haven't heard of that.
Guy, you're
That's a
supposed to
great
be on
thing.
this panel.
Get our first issue. There's a whole article about low-dose naltrexone. It's a great article. I wrote it.
What did you write?
Oh, nothing.
All right, clap if you want Guy Stores to join the panel like he's. Coming up, let me just also say, be careful of the health food store. The health food store took iodine, they were selling us salt without iodine. They pushed soy when it was already over. There was a big conflict about, the big debate 40 years ago about high fructose. And those who were against it were in the minority, but they were right. It's terrible stuff. So take his free muscle testing class, and you'll know what you can take into your body and not.
Moshe, did you have a question?
Yeah, thank you. My name is Moshe.
Here,
Everything I'm about to say, comment, question, is around this one idea. It's not just our bodies that need healing, it's our culture that needs healing. What we have is a fascistic medical system. I'm Jewish, I grew up with concentration camp survivors. We're in the early phases of a police state, and we can turn it around. We can turn it around. And one of the biggest central parts of it, in my view, is the medical record system and the way doctors are trained. And I want to thank Jack and everyone else for this. I used to be the head biologist, head health professionals trainer, head medical herbalist, and in charge of quality control for 5 of the very most sophisticated vitamin, herb, and enzyme companies. Source Naturals, Rainbow Light, Planetary Formulas, which integrates Chinese and Ayurvedic, and another one. I used to keep on my desk a tome that some of you know of. From the Congressional Office of Research in 1983, this big tome.
Excuse me, Moshe,
Comment.
Do you have a question
There's something I want you to respond to.
I like the
some of your vision, this is a preamble to this.
Okay.
And so we'll get to this. Benjamin Rush, George Washington's physician, said that unless we put freedom of medical choice into our Constitution, we will be in a medical tyranny. We're in it. I'm suggesting it's not just a medical tyranny, but the medical tyranny is the primary source of the larger tyranny we're in. So I think in Oregon we have a special chance to turn it around for a variety of reasons. And if we can put freedom of choice into the Oregon health plan, and you can vote with your own dollars whether you want to use alternative medicine, Chinese, natural, Western medicine. If we give our citizens the choice of how they want to use Medicaid and Medicare in Oregon, that will open things up tremendously, and we'll see there's tremendous wisdom in a polycultural approach to healing, which is what we need. Not a monoculture, which is what we're being subjected to, but a polycultural approach to healing with as many wisdom streams. So what do you think about how Oregon can play a role in opening the nation and the world up to this polycultural approach to healing?
I'd like to try to address that because are any of you aware of the so-called healthcare transformation effort of the statewide healthcare system, OHP, which you're referring to? That's been going on for over a year, I think year and a half, and it's a process allegedly to transform healthcare, but it's being driven by cost overruns you know, and problems deriving from that sort of thing. I've been trying to follow this thing. I've been trying to give input. What I find when I go up there is the word nutrition is basically, it's a dirty word, you know, it's not mentionable. You have to, you know, get approval to say it or something. But actually, and it's a very conflicted process. The governor appointed the healthcare transformation team, 40 people. Vern Sabo, who's a chiropractor in Albany, who's been very effective in getting alternative, you know, understanding and documentation, et cetera, and helping train. He's been working with the governor's office, the governor's people. They've got non-discrimination language in the bill, right? But that's where the thing gets a little funny, because the new organizations are called coordinated care organizations. And the idea is that there's going to be a global budget, which is not based on doctor visits, but based on an outcome. What I see in this whole process, though, is that alternative medical people, or like somebody like me, a nutritional therapist, we're not invited to the table. We're not mentioned, except in the last one where my representative and the head of the Benton County Health Department mentioned this. But I actually got up and made a protest because I asked questions and they weren't answered. And to have equality and democracy and effective, you know, medical and health care, we need to be, you know, recognized and at the table physically in determination as policies. But right now you have the older HMOs taking over as the CCOs. And there's a governing council with supposedly representation from the community. I think the way this plays out here in Lane County and all over the state depends upon citizens' involvement and making waves and expressing your needs. Because the most single asked for, desired, mentioned question at all these healthcare forums across the state, by far, there was like 250 questions, was for alternative health. So we are in the big majority. We just have to get effective in getting, you know, this communicated through the whole system. So.
And you need to go to your own legislator, and you need to tell them a specific thing that you have found helped you, and that you don't want it taken away when it's taken away. That's the kind of thing they listen to. And that's the kind of thing. It was not the councils, it wasn't any of the supposed high guys. It was patients from all over Oregon who went to the legislature and they told their little story. And the legislators voted for this bill. It's outlandish. This bill, I can't believe it passed. Do you see what I mean? It's so good, but I can't believe they actually agreed that it didn't have to be proven, or FDA and all that, but that's how sensible the legislators were. And they voted unanimously in the Senate. Only 2 or 3 people voted against it in the House. And on the, when it overrode the governor's veto, there were maybe 5 people out of the, 90? What is it? I forget. 60 and 30, 90 legislators. Virtually all of them voted for that bill.
Why did the governor want to veto it?
Because he's a traditional doctor. He was an emergency room physician. And it's politics. It's not about you. It's who the important people spending your money. And you're not in the equation. And it's time to stand up for your rights and get in the equation.
I just want to say, the bill actually says that if a person is certified or licensed in any healthcare field in Oregon, this should be covered by the bill. And then I think there's some statute about if that doesn't happen, there's some legal remedies. So there you go. We got an opportunity. You know, be aware of it. And
that's true to an extent, Chris, and I agree. They passed that in Washington, and it never got. It's been held up in the courts. But unfortunately, the medical board operates under administrative law, and that's totally different. They're not accountable. So even though we have a law that says this, they ignore it. So
tell them what that means.
Anyway.
What is administrative law?
There's 3 different categories of law. There's administrative law, there's criminal law, and there's civil law. And the legislature passes a bill, and then they appoint an agency to carry out that legislative intent. But unfortunately, the administrative part, sort of like the tail wagging the dog. They pass rules and they change things, and pretty soon there's really not a lot of resemblance between the original legislative intent.
Administrative laws, they just make it up as they go.
So, anyway,
No, literally.
Johnny's got a little presentation he wants to do, I want him to do, and then maybe we'll have time for more questions. Okay. If you have another question while we set this up, go ahead.
I've got a comment. I'm supposed to be working with the governor on healthcare reform. 5 years ago, I submitted a proposal and sent him a copy of my book, A Drug-Free Approach to Healthcare. He said, I agree, polypharmacy is an issue. I know he's an MD, but he did most of ER practice, and he did very little of the studying and prescribing. And he said, I think you should get involved, and I recommend you do later, which I started to do. I met with his health policy advisor, Dr. Veneto, in Salem a while back, and I talked to him on the phone a couple of times. He personally seemed like a nice guy. He's not an MD, he's a PhD, and he's worked with insurance companies and hospitals a lot, and he even established healthcare insurance in 2010 for Oregon, and I got a copy of what they're proposing, and they're proposing a lot of natural therapies. And he even called, when I talked to him one day on the phone, he said, oh, by the way, I'm taking nodine, goenzine, and maglistine, which I talked about three things in one of my books. And so he's looking at alternatives, and he seemed like a super nice guy, really. And the governor has got to come around, because he's saying we got to cut the costs and we got to prevent disease. And as long as they hold the doctors to this, restriction, it's never going to happen. So they got to change. And I tried to work with Volunteers in Medicine, United Way, got the same response every time. I'm sorry, that's not what we're doing. Volunteers in Medicine, the lady said, oh great, I said I could work with you on diabetes and on research. And so she was the director, and she looked at my books and started going through. She said, oh, that's not what we do. And United Way, the lady was good enough to say, maybe in the future that's something we could do. But until that changes, even the poor that need the help, you can't volunteer your help and help them, because that's not what they do. So that has to change, and until we change that, nothing's going to change. You can't cut the cost doing the same thing we've been doing forever. And so it's obvious they're going to be forced into it somehow. And I'm hoping we can get different doctors involved that want to get rid of this restriction, don't like it, and enough of them signed off on it and signed a petition. Maybe you got enough numbers, you can make things happen. And I'm hoping that's one approach. And maybe it's a movement we need to get moving. Otherwise, we're going to have to teach their patients, and they're going to quit going to those doctors if they don't. So that's something that they have to
Talk
consider.
to your doctors if you're the least bit open-minded. Guy Stores, how long have you done cranial sacral?
28 years.
28 years. He
What was
worked
the
with
question?
Jack for many, what, pardon?
What was the question you asked?
How long has he done cranial sacral? Why don't you just give us a definition so we can hear from you?
Well, first though, I'd like to touch on the subject that we've all been talking about on the panel. I think the thing that you need to keep in mind, and it really didn't strike home until recently. I was reading a book called Honest Medicine, where it was talking about this gentleman. He became a PhD biochemist. He was teaching doctors in the medical school. And in the medical school, he decided he wasn't getting enough consideration or respect, so he decided to become a doctor. As he was going through the residency, the fellow was the top head of the residency, decided that he needed to have a couple people assigned to him that would die from liver failure, eating amanita mushrooms, poisonous mushrooms. Their livers were failing. They had a very short period of time to live. And they felt that you needed to be able to learn how to counsel these families for grief. You needed to deal with these people in their final moments to be an effective doctor. Well, the only thing is this guy was a PhD in chemistry, biochemistry. He had learned about something called alpha-lipoic acid. He learned that if you use it possibly as an IV infusion, it might actually regenerate the liver. So he tried that, and lo and behold, guess what happened? Out of 6 people who were doomed to death, 1 of them died. These people were waiting for liver transplants. Stop and think how much money that costs for an average liver transplant. Okay? There were not enough donors at the time. Okay? The point is, this guy saved these people. He was ecstatic. He goes to his boss and he says, "Look at this. I saved these people." He's going, "What? Why did you do that? Why did you do that? You made me look like a fool to those people. Now, how am I going to explain this?" He was not concerned about alpha-lipoic acid. He was not concerned about the fact that the grief that it saved those families, the fact that it literally worked a miracle for those people. He was concerned about his image. And the point that the book made was the fact that medicine is a business. And that's something you have to keep in the back of your mind every single time. Medicine is a business. Is a doctor that's out there, has people, he's invested in mammogram equipment, okay, to check, screen for breast surgeries. Ones that show up, there's a little blip, we can take care of that for you. Is he going to shell out money for thermography if it may not tell those people that they don't need to have the surgery? Stop and think about it. And again, years ago, I was associated with this fellow. He was a construction contractor. He helped build big turnpikes down in California and UCLA, Berkeley campus, and all kinds of stuff. And he cited a little thing in regards to bureaucracy. He said, most people whose job is to inspect things, their job is really to perpetuate themselves, justify their existence. Okay? So when you get a whole bunch of people deciding this policy is going to be evaluated to make sure it's done by this person, pretty soon you got 5, 6 people involved. Okay? Going back to this gentleman over here was talking about in regards to longevity and stuff. I remember years ago I was with Gambee's at up in Portland, Deepak Chopra spoke, and he was talking about certain things that they found were common with all people that were happy, that lived a long life. Vitamins and exercise, although they're good things, and nutrition weren't on that list. 1 was you had a connection with a spiritual being. 2, connection with another person. If not a person, then at least a thing. And 3, you had a passion, something to get up every morning for. Whether it was to right a social wrong, whether it's to catch that fish that's out there on the river that you haven't caught for years, or plant, a wonderful garden that people are going to enjoy forever, or create a wonderful work of art, or save another circumstance. Those are things that are attainable by all of us. And the bottom line is we still have to go back and have the responsibility on our own shoulders to be able to figure out what things work for us. It's unconscionable in my estimation that in a state where they have physician-assisted suicide, they have legalized medical marijuana, but a doctor cannot prescribe thyroid for people. Despite the fact that the past 5 years of poison control centers, an average of 13,000 people a year call in saying that they've overdosed on thyroid. They're going to have a heart attack. They're scared to death. There's been no deaths. In 5 years of people overdosing on thyroid, okay, the medical board feels that that's not right. Okay. Moreover, recently, they found in some studies that prescribing testosterone to people with congestive heart failure worked better than any other modality of treatment for helping improve those people's cardiac function. Testosterone, better than any other medication. And yet they're afraid. And even though in that study the doctor said there's no connection between testosterone level and prostate cancer. Okay? So the point is these people, like Dr. Gambee has the article that you'll be getting, makes reference to the fact that most doctors are too busy with their business to be able to take time to learn how to help make people better. So you have to try and help educate them the best you can for yourself. You're the one that knows yourself best, okay? And that may be knowing how to do certain things. You may be needing to go to an acupuncturist rather than a doctor, or maybe a nutritional therapist, or maybe someone like me that does craniosacral therapy. So, but the point is learn what your body needs, how to take care of it. That's your best way to be cheapest, okay?
And I want to say, this is Guy Storrs, if you didn't get his name. He writes the articles Apple a Day in our magazine, and he's written other articles. There are so many people. Johnny, go ahead.
Okay.
This is our son, John Gambee, by the way. He's John P., and this is John E.
Yeah.
And he's the publisher of our magazine.
And he's very handsome.
That's his wife.
Right on cue. Thank you, Brenda. Well, obviously, thank you for being here. So, the information that we're going to go through real quickly could be, we could talk about any particular thing, and we just picked one topic tonight so we could get through it kind of quicker. The same information is available on name your mystery. So, the other reason we chose heart attacks is because it's the #1 killer. 25% of the people that die this year in Lane County will die from this reason. So I thought that would be a good place to start. But again, this information is available on the other things. So half the people that get a heart attack die. The other half survive the first heart attack. But, those who refuse to learn from history are doomed to repeat it. We've heard a lot of tidbits from history tonight, and I think I read something this week, and it was really interesting. The amendments to the Constitution that were passed were all passed within a year. Now, you think of what has to happen from a grassroots perspective to get an amendment to the United States Constitution passed within 12 months. And yet everyone that was passed within 12 months. So do something. You're doing something tonight. Keep doing something, because that's really the strength of this whole thing. It depends on people like you and me going out there and doing something. And I just, you're as powerful as you want to be. Chris is up there finding out about this thing, we've never heard of. Spend an hour a week. Make a commitment to spend an hour a week doing something, and you'll be surprised at how motivated you are to get out of bed. You get involved, it's exciting. All of a sudden you're like, yeah, already. Okay. So, in 2011, 785,000 Americans had a heart attack. It's #1 out there. $292 billion was spent on the care for that heart attack incident in the United States. That's $292 billion. We can hear that number so often now, it just starts going over our heads.
How many millions is that?
It's on the screen, Janet.
Oh, you don't get the prize.
Well, she told me that this morning, so I put it in there. 292,000 millions. Just this year was spent on this.
It's like a stimulus package.
Now, this is just the direct cost. That's the direct cost of paying for the doctor. 347. Now you can look this up yourself. I didn't make up these numbers. A lot of us, spend a few hours on Google. It's really interesting what's out there. I mean, you hear about these problems, but it really was interesting to me to put them into some perspective. So I went home and I asked Brenda. I said, "Do we have that saved? Are we ready for this thing that's going to happen to one or the other of us?" I mean, 50% of Americans get this, and half of them died the first time. The answer was no. We don't have that put away. This is the other part of it. Indirect cost is almost twice as much. And that's the cost of losing your job, retraining, not being able to go to work.
Maybe insurance payments.
A funeral, sure. So together, and this came from, you'll see it all over when you get on the Google, that they just kept talking about that number. The Centers for Disease Control, NBC News, ABC News. There's lots of people that are saying this number. Now, this is the amount an average American person has put into Medicare over 40 years. So, half of us get it, but this is what we put towards it in the form of our Medicare insurance program. This does not equal that. This tells us that this is not a sustainable program, which means that if it continues, you will not have care, or your children won't. Now, in this meeting tonight, it's been really fun. We had 3 generations of one family and 2 generations of several families. Here, it's kind of cool, but you know, this is a generational thing. You know, you might get treatment today, but this is not sustainable. So you may get treatment today, but your children may not get it. Now, next week, this year in Lane County, that's the number if we bring it down to our portion of America. So 893 people in Lane County. 445 people in Lane County will die this year from this particular cause. Check the obituaries every day. In the obituaries, several of the people, this is why they're gone. I mean, this is 1 person per day, roughly, in Lane County. And if you check the obituary. Now, this is the direct cost of those heart attacks just in Lane County. Count T. 319, that's 319 million. That's just in Lane County. This is the direct and indirect cost, again, just in Lane County, because, you know, America is a big place, but let's talk about Lane County. Okay, now, this is the cost of taking vitamin C for 40 years. $3,372. You can take vitamin C, 15 milligrams a day, for 40 years. 1,500. Yeah, 500 milligrams 3 times a day. 1,500 milligrams. Now, watch this. And be prepared to understand the solution to healthcare crisis in Lane County or in Oregon or in America. Here's the solution. 500 milligrams of vitamin C 3 times per day reduces the amount of plaque in your arteries by 60%. Now, if the amount of plaque in your arteries is cut in half, what do you think happens to the number of people that die from coronary heart disease? There you go. Next slide. Reducing the number of people suffering and dying from heart disease by half. Okay, so does alternative medicine work? Yes. Is it affordable? Yes. Is it sustainable? Yes. It is. This is documented. You can find it on the internet if you take the time. You can find it in Dr. Gambee Alternative Magazine in the hallway on your way out the door if you didn't get the latest issue. It's there. 1,500 milligrams. No other variables changed in that particular study. You know, that's the only thing he changed on those people that were part of that study. And the plaque virtually vanished. Now, why is that? That's because the lie about heart disease, which you got to read about in the magazine, is not the plaque. It's that there isn't vitamin C in your system. If you get vitamin C in your system, your body quits repairing the arteries with plaque. It's pretty cool. 3,000. Again, I mean, that's the cost. That's 40 years. But that won't sell coronary heart surgery, so they don't tell you about it. Because on the other end of this equation, right, is the person that gets paid this amount for treating you. Why is he going to tell you that? Why is she going to tell you that? Well, you just cost them their boat. You just cost them their payments on medical school. So they're not going to tell you that. But the person who runs a health food store probably will tell you this because they're going to earn some money that way, and that's all right. At least they're not costing our children and our children's children. Okay, so this is the price to have that wonderful experience. That's what you pay to experience that. That is unsustainable. This is the cost to prevent it and to enjoy a life, and that's sustainable.